connecting to YouTube live stream. Welcome everybody to the Clear Vision Wednesday show. I'm Claudia Mühlenweg, a holistic vision teacher and creator of the Natural Clear Vision Method. And I have another super special guest here today with me. I am so excited about this topic, which isn't talked about that much. And the title of today's presentation talk is called How CBD Can Improve Brain Health and Eyesight with Dr. Hyla Cass. I just want to say 3 words about her before I bring her on. She is an innovator and expert in the field of integrative medicine and psychiatry and known as the drug-free psychiatrist, which is so amazing. So Dr. Hyla, let me bring you on so that everybody can see you. Oops, I just hit the wrong button. There you go. Welcome.
Hey, I'm so happy to be here.
Yeah, me too. So thank you. I know you have some workmen in the unit next door, so hopefully we don't get any interruptions and loud noises. So tell us a little bit about, your experience and your background and how you ended up getting into the whole CBD thing before we dive into CBD directly.
Love to. To begin with, as you said, I'm a non-drug psychiatrist, and that's unusual right there. I mean, the psychiatrists by definition are the drug people. They're the drug pushers. You go in, you get a prescription, and, then you come back a month later and you get another prescription and so on. And what I noticed very, very early on even in my residency was that they didn't work very well and they had side effects. And then the new ones came in and they had more side effects and they didn't work any better and they'd be piled on. And it segue to more recent years, people were just snowed by these meds, not doing well on multiple meds, doing probably worse than they were before they even started. And you can tell how I feel about meds. Now, occasionally they're useful, like in an acute crisis, but the way we do them here is in the US is we just prescribe forever. Not good, slippery slope. So people have been coming to me to, first of all, avoid getting on meds, which is ideal, or then a little more difficult is getting people off of meds. And for this, I've been using natural means, diet, lifestyle, many different methods, but nutritional supplements have been extremely important in helping to balance the brain. So if you can give the brain what it needs to make the right neurotransmitters, which your brain will make, we have this great pharmacy in us, and it'll work for us. It's just amazing. Feed it the right ingredients. It's like baking a cake. You put in all the exact right ingredients in the right proportions. And in fact, it doesn't have to be the exact proportion because your body is a miracle and it knows how to take what it needs and turns it into neurotransmitters and receptor sites and brain cells. And you have something that's actually a treatment. And you don't have to rely on meds that are just suppressing symptoms. So that's a long answer to a short question. But then you asked me about CBD. So I was using a lot of amino acids, vitamins, essential fatty acids, all of which are very important. Then I discovered CBD a few years ago, and that was the icing on the cake, because that actually helps to manage the neurotransmitters and the production of neurotransmitters. So we have a really complete system built in, and when we add the CBD, it interfaces with our own inner cannabinoid system. There's the phytocannabinoids from plant like CBD, cannabis, but there's also endocannabinoids, which are what we make in our wonderful, miraculous inner pharmacy. So that's what I work with. I work with nature, and nature, you can't fool with Mother Nature. And when you do the right thing with nature, you get beautiful results.
That is so interesting. And, CBD, I think you just explained a little bit but people hear cannabinoids and which is such a hot topic now, but tell us a little bit about, because people are like, can this make me high? What if I take this stuff? Can I drive? Whatever. Tell us a little bit about what CBD is and what it's not. And is it legal? Because that's another whole debate. take us a little bit into that before
Right.
we, you know.
Listen, we all had the same questions. I first heard about CBD, a friend of mine wrote a book on it, and I said, it's an excuse to get high. And it's not, getting high isn't bad. So I'm not casting any aspersions on that. But I thought, well, how could it be therapeutic? I don't know. Anyway, I read the book and I got it. CBD is not THC. Both of them are from the cannabis plant, but the hemp part of the cannabis plant is kind of bred to be long, stocky, tough to make paper and cloth. Hemp was used forever until it was banned along with THC, which is such a loss to us because we actually need these phytocannabinoids to work with our own endocannabinoid system. So THC is the part that gets you high, which is, as I said, it's okay, but what's happened is the THC has been increased. The plants have been bred. They are, this bushy plant, lots of flowers, and the flowers yield high THC. So they've been bred to yield a lot of THC. So when in the old days, maybe in the 60s, the marijuana that we had was maybe 4%. Now it can be up to 20% THC. And even more, some of it has almost no CBD in it. And guess what? When you fool with Mother Nature, you run into problems. So when people are getting this unbalanced THC to CBD with all this THC to get you high, very little CBD to balance it, you run into irritability, paranoia, and even psychosis. Then these poor people end up on antipsychotic medication.
Wow. So yeah, then it's like that vicious cycle, right? So that's good to know. And I know we don't want to talk about THC here, but I do have a quick question. So what is it good? Like for people, again, this is not our topic today, but it's just this little side note. If people do want to use THC, what is an important good ratio to watch out for? I just want to make, or is that not something that we want to? I know
I'm not an expert there, but you want to have a reasonable amount of CBD to balance it.
Gotcha.
And it certainly will do that. And when I see a case of somebody who's had a quote THC psychosis, I don't think of it as, it's unmasking an existing psychosis or pre-existing psychosis. I see, okay, the THC just tipped the balance in that person's brain. And what we do is we give high dose CBD. It will actually help to reduce the effect of the THC. The person starts to normalize and they don't need to get onto medication. So we've actually treated the problem at the site of the problem, which is too much THC on the receptor. We remove it with the CBD. And I've actually seen this. I know recently there was a young man who was very, not only high on THC, but psychotic. And he was on meds, which weren't quite holding him. Anyway, his mother had, on my advice, gotten him some CBD. And in fact, she got it in the form of gummies. Now, I don't know about gummies. I like to see them without so much sugar, and you can get them with less sugar. Anyway, whatever. She bought a bottle that had 1,000 milligrams in the whole bottle. Now, the usual, like the highest dose you would do is maybe 100 milligrams. Anyway, this young man who was pretty out of it, pretty psychotic, ate the entire bottle of 1,000 milligrams of CBD. Now, is that a lethal dose? What is it? Well, what she discovered was, he said, "Mom, I'm feeling normal, and I'm so sorry about how I was behaving." So he got his brain back. Now it's a little tricky because, a little while later, he decided he really wanted to smoke weed again. So we're working with that. But it's quite amazing. It really does work.
So tell us a little bit more how it works with the brain. You talked about the endocannabinoid system, right? Like, is there any kind of or maybe even combine that with like other stories, like what kind of brain, like how can it improve our brain health and our eyesight? Eyes are part of the brain, obviously.
Right.
And what can it actually help with, or how can it make us feel, like you said, balanced, or just like letting nature really take care of us?
Well, first of all, what we know about CBD is that it helps with the brain in so many ways. It helps with dementia, with traumatic brain injury, with anxiety, depression, PTSD, OCD. So it has a really broad range. And why it does that is, first of all, it's an anti-inflammatory. We know that. The other thing that it does is it actually helps to produce neurotransmitters or brain chemicals. So it helps to produce GABA, which is calming. Mm-hmm. It helps to raise serotonin, which is calming and reduces depression. It brings you to a better mood. And it even interfaces with the catecholamines like dopamine and norepinephrine, which help you with focus and concentration. So it has very far-reaching capabilities. And that's because this endocannabinoid system, which we have inside us, and the endocannabinoids that we know about are anandamide and 2-AG, we make these ourselves. And sometimes we're low in it. We have a low endocannabinoid system, or we call it low endocannabinoid tone. And how do we know? We can't really measure it. But if you have all those symptoms that I mentioned, or any of those symptoms, pretty likely you have a low endocannabinoid tone. But the good news is we can increase it. We can increase the endocannabinoid tone by administering CBD. And the CBD will help bring up our natural endocannabinoid system. It helps it from our endocannabinoids from like the 2-AG and anandamide from breaking down. So we have more of it in circulation, and it works very quickly, like amazing.
I know I tried I tested you have a daytime CBD oil and a hemp. You can talk more about those products too, because I know you have fantastic, super pure products, but I noticed just the focus, the focus ability and the energy was so much more improved. That's a daytime and a nighttime. And because mental focus is connected to visual focus, right? Like there's a direct connection to that. And so I really noticed that there's more ability to, focus on things and be relaxed at the same time. So you're not stressed, you're calm and focused. A lot of times we like focus, focus and relax is opposite.
You got it.
Right. So go ahead, Troy.
No, that is a perfect description. I love it. So you're actually seeing more clearly and in a more relaxed way. Mm-hmm. So it does the de-stressing while you're having increased focus and concentration, increased productivity. And then if you want to use it in the evening for sleep, for most people, you need to take a higher dose. And that's interesting because lower doses will tend to cause better focus and concentration. It's like an upper. And if you take it, particularly at the end of the day, it'll relax you more. And not that it doesn't relax you in the morning too, because as we described, but it'll relax you in the evening and really help you head off into a nice sleep.
Yeah, I noticed that my sleep was pretty good, but I do, since I hit menopause, I do wake up like usually like sometimes like one time, sometimes 3 times a night. And when I started taking, I think one time was like the only, like no more than one time did I have to get up. So I felt like my sleep was even deeper and better. In the past, I used to take melatonin, but that really knocks you out and it really screws up your own circadian rhythms and your own melatonin production. So this feels like a much more balanced and, just a much better option of improving sleep versus taking any of those sleep supplements like melatonin. So
yeah, well, melatonin is a hormone and it's potent. And my feeling is that you were making enough melatonin, that wasn't the issue.
Right, exactly.
There's ways to tell. It's like if you're taking too much melatonin for you, you get super vivid dreams, like almost more than you want. So you may have not needed it and it just needed a lower dose. But that as it may, the CBD does it in a different way. It interfaces with the endocannabinoid system, which covers so many other aspects, and mostly because it's dealing with your neurotransmitters, it's enhancing your neurotransmitters, and it just gives you a smooth flow into sleep, and you tend to stay asleep, as you mentioned.
So you talked about the neurotransmitters. I mean, dopamine is kind of the motivation transmitter, and obviously dopamine has a direct connection to vision too, because you can't focus if you're not motivated. And so it's kind of really interesting how it helps to balance just your natural, brain's ability to focus and to sleep and to relax and do all those things. So you talked a little bit about inflammation, right? You said that it also reduces inflammation when we take CBD. Did I hear that correctly?
Yes, it does. It's excellent for that.
Right. Inflammation is the cause of, many eye diseases, and I know we don't have any specific science in terms of CBD and eye diseases that hasn't been researched yet, right? As far as I know, is that correct? Or is there any kind of research?
That's absolutely right. And the eye is the outgrowth of the brain. So anything that's affecting the brain will affect the eye. So if you have an anti-inflammatory effect on the brain, and that's going to show up as I said, it helps tremendously with TBI, traumatic brain injury, and also with dementia. Helps to form new connections, new brain cells, and it'll do the same in the eye.
Yeah, so this is so wonderful. I mean, obviously, like you and I are really big on healthy diet and making sure that we have all those bases covered, and not just using it as a band-aid, but as a way to kind of support our already really healthy lifestyle. So I have family members and friends that are on psychiatric drugs, and so I know firsthand, not from my own experience, but seeing how harmful and how many side effects these drugs can have. And it's just wonderful to hear that there's a solution for our brain to just function naturally without, like you said, in most cases, I mean, we're not saying that everybody can just throw those away, obviously not, but to really balance that. Is there anything, any kind of side effects or warnings, any drug interactions or anything that people need to be aware of?
You need to see the drug that you're taking, what the P450 system or the breakdown enzymes in the liver are compared to the breakdown enzymes for CBD. But that being said, you may worry about blood thinners. And at the same time, we haven't really seen any bad effects. And basically, if you're sticking under 100 milligrams of CBD, you really have nothing to worry about. There's just been no reports of any drug interaction.
So that's a good point to bring up. So with dosing, right? It's like you talked about marijuana at the beginning, how it was like way lower in THC in the beginning. But when it comes to CBD, like how do you have to talk to somebody like you, or like what's the best way for people to figure out, hey, I want to get started with this, but I don't really know. What would you tell somebody that wants to start, but do they need to see their physician in terms of the drug interactions, or like what's the way?
There are sources that you can look up, and I'll give you one afterwards that you can post.
Okay. So that's awesome. I posted your website.
I mean,
yeah.
Theoretically, I should say check with your doctor. But like, come on, how many doctors are going to know about CBD medication interactions, right?
That's a good point.
So, like, really? So you need to do the research yourself. And I've used...
Sorry, go ahead.
I've used it alongside psychiatric medications when I'm withdrawing people from meds. It's very useful. So what I do is I give it at, a few hours away from each other. So you're far less likely to have an interaction. And the only side effects you get, some people may get overly sleepy, and then you just take a lower dose. For some people, they may get loose stools. Occasionally, people get nauseous from it, but actually it's good for treating nausea. So that's an interesting thing. what I'm really saying is we have biochemical individuality. We all react differently. We all need different dosages. And it's not like you say, oh, for pain, you do this, for
Right.
PMS, you do this, for depression. It's not like that. You know, that's how it is in the drug world. But that's not how it is with CBD. It's very individual. You need to titrate it. And that's why I supplied it in, well, yeah, by the way, I actually developed my own line of CBD because I wanted to know what was in it. I wanted to have control over what was in it in terms of the ingredients, the concentration, the taste. Mine has a lemony taste with lemon essential oil.
Yeah, it
so
tastes really good. It's compared to stuff.
right. Thank
Yeah.
you.
So yours
It's
is, yours is grown in the US and it's organic.
organic, yeah.
What do people need to look out for when they select a product? Like other than obviously you want organic, you want highest quality, what else do they need to look out for?
You want to make sure that it hasn't been grown in soil that concentrates. See, hemp, the cannabis plant has actually been used for soil remediation because it soaks up toxins. But you don't want it to be soaking up toxins that you're then ingesting.
Right.
So it needs to be grown in soil that has not been exposed. So it has to have been remediated soil. And you can get that all from a certificate of analysis. So most brands will supply you with a certificate of analysis. And
that's really helpful because, yeah, it's such a big.
Yeah, I mean, we know, yeah. But we know the farms that we're using, and we know that they have clean soil. So we don't have to check the soil for every single batch because we know that. But we certainly check every batch for the ingredients, the strength of the cannabidiol and the other ingredients. So there are actually other cannabinoids. There's not, the main ones are THC and CBD. But then there's also CBG, CBN, CBDA, THCA, a lot of ingredients. And we get to analyze those and see what's in them. And they work together synergistically. It's called the entourage effect. So my preference, by the way, is to use full spectrum CBD. And full spectrum means that it can have up to 0.3% of THC in it. Now, that's not nearly enough to get you high. It won't do that. But by leaving it in, we're actually minimizing the processing of that product. So you understand that in removing the THC, there is probably some other ingredients, some other health-producing ingredients that are removed. So my preference is to have that little bit. The only downside is that THC can actually concentrate in the fat cells over time, and it depends on your own metabolism, your own fat metabolism. And for people who are subject to drug testing, random drug testing, like if they're on probation for their job, I think in military, then you actually need to avoid even that trace of THC and then use the THC-free product.
Okay, so yours, I know the one that I tested was full spectrum. So do you have products that are completely free of THC, or is that something?
Right, so it's the same thing, only the THC's been removed.
Gotcha.
And we get good results with those too.
Okay, that's a really good point to bring up, right? In case, you never know if you need to do those tests. And I think certainly, like you said, maybe even pilots or some other people have to do these tests and make sure. Anything else that we haven't covered yet? Because I think you had a few, maybe you have some more stories of people improving their brain health, or anything else that you feel like we haven't covered yet?
Well, one of the things that's important is people may wonder, well, do I need THC? Would that be useful? I don't have any real symptoms. But what it does is CBD will tonify the endocannabinoid system. That is, it'll bring it up to a good level. And most of us are rather depleted. We have a lot of stress. Our diets may not be so good. And what happens is people will try it anyway. Maybe that somebody gifts it with them or someone in their home is using it. And what they discover is certain things that they didn't really pay attention to. So they suddenly realize, oh wait, I had that kind of chronic pain in my neck and I was just living with it. And like, oh, it's gone. Or, a dull headache. So as I said at the very beginning, anybody who has any of those symptoms that I mentioned, that, poor sleep, pain, depression, anxiety, migraines, is probably low in their endocannabinoid system. So it's always worth trying it, tonifying your endocannabinoid system, and see what it does for you. And then, by the way, you don't have to take it forever, and it's not addictive. So if you take it for a while, and then you're feeling okay, you can actually lower your dose, and you may even be able to go off it. It really depends on your physiology, or you may go back on it when you have a time of more stress. But it really works very well with the body. It's kind of made to work with the endocannabinoid system.
We have some questions on YouTube. One person is asking, what about the brain-gut connection? Is there anything to cover in that regard?
Oh, absolutely. And it goes through the microbiome. CBD definitely influences the microbiome, and there's also a lot of gut-brain connection in terms of the immune system, because a large part of the immune system lives in the gut. Also, we make 95% of our serotonin in the gut, and CBD influences serotonin production.
Wow, I did not know that. That's cool.
Yeah.
Another question is, could it heal gut issues, leaky gut, candida, stuff like that?
I have given it alongside other things for leaky gut because it's a whole thing, but it definitely heals cell linings. It heals cells. It's anti-inflammatory. So it's always good to add to the mix.
Okay. And I have a question here in our Clear Vision Club that somebody said, found it very difficult to get the right strain, even with the direction of the representatives at the place where they sell it. I was trying to use it to reduce some of my pain, inflammatory conditions. So what is it in terms of like, how do you find the right strain, or how do we, is there any kind of thing that you want to say to that?
I'm wondering, it sounds to me like she went to a dispensary.
Yeah, and this was about in Illinois. So I think we haven't really talked about the legal aspect of that. Maybe that's where this comes in.
Yeah, I'm not talking about THC here. So I'm not going to address that. So she's saying that she wasn't clear about the information or the advice she got at a dispensary, if I could extrapolate.
Right.
Because there aren't that many questions about CBD. You try it, you start low and slow, and you build up. So you'll take, it's like, here's the bottle, right? So if you're a good visual, some people are more visual. So you shake up the bottle, squeeze it, open it up, this is about, whatever comes up is about 1 milliliter. So you could take about half of this, take about 10 drops and see what happens. Wait 15 minutes. If nothing happens, take another 10 drops and keep doing that till you find a dose that goes, that's, where you get the pain relief or the mood relief. And I've seen people go from being highly anxious after a dropper full of this in my office, they go, oh, I feel good. Whoa. Or that young man, 1,000 milligrams. But
your connection was chopping off. It's coming in and out a little bit, but we missed. What was it with the young man? That part was missing.
Well, the young man who took a lot, he took 1,000 milligrams. He probably didn't need that much, but it certainly worked. And then I recommended a much lower dose, but a consistent dose for him.
So speaking of the young man, if there's someone who's kind of been overdoing it with the THC in the past, right, who's just been like smoking weed like crazy amounts with high THC, can they now take the CBD, the full spectrum oil, or would you recommend for those people not to have any THC? I know you said a tiny amount.
It's a tiny bit. It's fine. It's fine.
Okay, that's fine. That's not a problem.
It's not going to cause any harm. No.
Okay, gotcha. Let me look if there's any.
That's a great question.
Yeah, because I definitely know people who had that, and I was like wondering if that makes let me look at YouTube. There's a how can it help with your vision? Is it about helping us relax? Obviously, I teach everybody that relaxation is the key to great eyesight. But we talked a little bit about inflammation already and neurotransmitters. Is there anything else you want to add to the aspect of vision? And I know you're not an eye doctor, but in generally speaking, how can CBD help?
It helps with neurons. And the eye is an outgrowth of the brain and has neurons. And so it's going to positively influence the neuronal growth and connections in the visual system.
Right.
So, and the visual system isn't just the nerves, it's actually, the occipital cortex, and it's a whole system. And there are CB1 and CB2 receptors in the visual system. So we know that the endocannabinoid system influences it.
That is so fascinating. I mean, and the inflammation, right? I mean, all these different aspects. So that's so interesting because, right, I always say we don't see here. We actually, this is just the light receivers, and the retina is part of the brain, but we actually see in the visual system, in the visual cortex and other pieces of the brain that are involved in the seeing. So that's a great response. Somebody says, I have anxiety, digestive issues, hormonal, and the thyroid nodule, suspect of cancer, and I don't want surgery. I'm interested in trying it out. So is there anything about all these things? We talked about anxiety already. I think we talked about digestive issues a little bit. You talked about the gut lining, how that can be improved. Is there anything else that you want to add to that?
That question was, can she use it for hormonal balancing? Was that? It was kind of a long question.
Yeah, it was anxiety.
And it's absolutely.
And hormonal and thyroid. Mm-hmm.
It really does help to balance hormones. It interfaces with the hormonal system. Great for PMS, great for menopausal symptoms, and the collateral menopausal symptoms, which include anxiety and sleep issues. So it covers a very broad spectrum because the endocannabinoid system runs throughout the entire body, and its job is to help us relax, digest, protect, and forget. So that helps us to deal with stress. It helps us with it protects us from post-traumatic stress disorder. They've done research and shown that people who have low endocannabinoid systems or low endocannabinoid tone are the ones who get PTSD. Other people exposed to the very same trauma. This was actually a study done on people who had witnessed the World Trade Center thing. So the ones who did not suffer PTSD were found to have higher endocannabinoid tone. So,
interesting. That is so fascinating. So somebody's asking about glaucoma. So I know that I think said there is no studies out there, but when you talk about relaxation and stress relief,
there are no human studies on glaucoma. There's a rat study, and basically THC is used to treat glaucoma. And in cases, and it's not entirely clear, but it's likely that CBD is actually not good for glaucoma.
Ooh, interesting.
So that's something that, I was trying to look up some research, really couldn't find it. And it's not something that I deal with. I prefer talking about things that I'm actually dealing with firsthand.
Right, I totally agree. It was a second, but this was a question that came up. So, and other people, I've heard that people say it helps with glaucoma. So basically, we don't know. The word is we don't know, and you don't have any experience, and I had any patience with that. So we can't really say either way, right? It sounds like the rat study was almost saying it was making it worse, or at least it wasn't making it better. Okay. So I think we're going to come to a close here. Hi from Ray Gottlieb from Florida. He's on YouTube. I don't know if Ray Gottlieb says hi. I guess he met you before. He's a fantastic former behavioral optometrist and vision teacher.
Oh, of course.
Yeah, so he says hi.
Oh, hi back. Oh, my heavens. Where is he?
He's in, I think he's in Clearwater, right? Trisha, maybe correct me if I'm wrong. And I know it's Florida. So
right. I'd love to get back in touch with him.
St. Pete in Florida.
Wonderful.
All right. Well, thank you guys. So I don't see any more new questions on YouTube. We will close the YouTube live and do a little.
I still have something to add before we close YouTube live.
Go ahead.
And that is that I have my own line of CBD, and you don't need a prescription. You can order it directly online from my website, drcass.com. And anybody listening can get a 10% discount on their first order by using the code DRC10.
I put that in the YouTube chat too, and the links to your shop. I put that in the YouTube chat.
You put it in chat. Okay.
Yeah.
And then after today, we can use a more personalized code, and that's Claudia. Claudia awesome. For a 10% discount. But for today only, it's DRC10. So you don't have to wait, delay gratification.
Thank you. And it's such a relief knowing that you have such high quality product, because like I said, there's so much, like supplements, when you look at supplements in general, right? There's so much bad stuff out there that doesn't have in it what it says it has. Might even have toxic ingredients. So I know that your product is super clean, super pure, and of the highest quality. And also, I think if people have questions, is there a way to connect with you or to talk to you?
Yeah, so they can connect through the website.
Okay, great.
We will answer.
Awesome. So if you have any more specific questions or about your conditions, and you can connect directly with Dr. Hyla Cass on her website and find out more. So thank you so much for being.
The other thing I just really need to emphasize when you're dosing is start low and slow. Okay, so you start. I mentioned it, but you start with, say, the 750 in a bottle, and that's how much is in a bottle. So in the 750 bottle, it's 25 milligrams in each cc. So this is 25 milligrams. The entire bottle is 750 milligrams. So most people start off with the day and night combo. They save a little bit by having the combo. So the day has the day terpenes, so they add to the alertness. And the nighttime has terpenes that help you to calm down and relax. So it's a really good one too. People have been really happy with that. I think that's what you have.
Yeah, that's what I tested, and I'm really loving it. I mean, I just feel that natural energy in the morning and the focus, and I feel like the sleep was definitely improved, and it wasn't like you were knocked out or anything. So I can attest to the day and night one. I don't have a specific link for that right now, but I posted the links also underneath the YouTube description, and code DRC, and then after tomorrow will be code Claudia. It gives you 10% off if you want to try it out. So yeah.
Okay.
Well, thank you so much. Goodbye to YouTube. Subscribe to my channel. Follow Dr. Hyla Cass. Check out her blog. There's also lots of information on her website. You can learn more about that if you want to dive a little deeper initially. So thank you so much. This was awesome. I learned a whole lot today, and super grateful to have you here. And now we're going to do a little mini Q&A on Zoom with my Clear Vision Club tribe. That's not live streamed to YouTube. So goodbye, YouTube. See you. And not see you that next week. Next week is a break week, but then after that, we're going to be back in 2 weeks. All right. Bye.